Hi, welcome to the Avaaz podcast. This is Dr. Madhu, Dr. Nav, and I'm Roop, and we're here to talk to you today about contraception. This is Avaaz, the podcast for South Asian women's issues, health issues, and wellness issues. Contraception is something our age group will know very much about, but things have changed since we probably started using it. So let's talk about what contraception is.
Well, contraception basically is birth control, basically how not to get pregnant so that basically you don't have a baby.
By choice. And what different kinds of contraception are there now?
So this can include things like medications. It can include devices that are either inserted into the skin or into the uterus, or even surgical procedures that basically prevent the sperm from fertilizing the egg, and then it prevents it from implanting in the uterus, and therefore you prevent pregnancy.
Okay. And so that's how it works. Sort of.
Well, there's different ways it works. So those are different ways we can have contraception. So the ways it works is there's three different ways. One is you just prevent ovulation. So you prevent the egg from being released from the ovary. The second way is you prevent fertilization. So you prevent the sperm and the egg from fertilizing to create an embryo or a zygote. The third way is you prevent implantation. So you prevent the fertilized egg from implanting into the uterus to, allow it to grow into a fetus. So those are the three ways. But let's explore in more details what these ways are.
Okay.
So I would say in my practice, I would see mainly the birth control pill or IUD. So let's talk about the hormonal stuff first. So hormonal things would be like the birth control pill, patches, hormonal patches. There can be vaginal rings, which we'll talk a little bit about later. There can be implants. There can be injections. So that all of these will release hormones. They also can increase the cervical mucus thickness to prevent pregnancies. And then there's IUDs. So IUDs are called intrauterine devices, very common in the South Asian population, very common in the South Asian subcontinent, and also probably one of the oldest forms of contraception. I don't know how old, but it's older than the birth control pill. Birth control pills started in 1960, so it's before then. And so IUDs are intrauterine devices. So the most common our South Asian community loves these are copper teas. We call them copper teas. And basically it is that. It is a copper wire type device that basically does not allow for implantation of a fetus. So it's creating a hostile environment so the embryo can't implant. And they're very effective. The other IUD is a hormonal IUD. Marina is one of the brands, but there's different ones. Marina is a common one here in Canada that we use, and that is a hormonal IUD that also helps to prevent pregnancies. How effective are these? I would say the IUDs are honestly about 95 to 99% effective. And oral contraceptive pills or the hormonal pills or patches are about 91 to 99% effective. There are some things that can affect their effectiveness. And IUDs are good for about 5 to 8 years, depending on which one you have.
Which is great because once you have it put in, then you don't have to worry about
There's no thinking.
Yeah,
at all, which is a great thing about IUDs.
Whereas if you're on the hormonal pill, you'd have to take that every day.
Yeah, I would say, so let's talk about some advantages and disadvantages of the oral contraceptive pill, which we're now going to refer to as the birth control pill, because that's how most of us know it by. Okay, so let's talk about disadvantages. The disadvantage is you do have to remember to take it every day. So that is a huge disadvantage for people who are busy or younger population might not remember. It can make some people moody. So I have had patients who say it really makes me down or moody, and we take them off or angry. Yeah. And some medications can interfere with how effective they are, like some antibiotics and other medications. So you would have to talk to your primary care provider or your pharmacist to figure that out. What are the advantages of the oral contraceptive pill?
Well, first of all, you get lighter periods, which is such a blessing for so many women. So your periods will slow right down. They won't be as heavy. They won't be as painful. And that often is a reason many women are put on birth control pills, is specifically for that reason. Another thing is, and the other benefit of that is that you have less chance of anemia, which is one of our topics that we've discussed in the past. Your period will become less painful. It also helps with acne. So many women, young women, are prescribed birth control pills specifically for acne control when other methods don't work. And it decreases your chances of ovarian cysts. So again, less pelvic pain.
Yeah.
It decreases your risk of ovarian cancer and uterine cancer. So that's really good.
That's a huge advantage. Yeah. Like, it significantly reduces it.
I've heard that some young women are reluctant to see their doctor to get prescribed the hormonal birth control pill in case, their parent finds out. But they may be needing it for not just birth control. They may need it actually for, as you mentioned, acne control or to have lighter periods if they really start,
Yeah.
right?
Yeah.
So just because a young woman is on birth control, it doesn't mean that she's sexually active.
Nope.
And whether she is or not is besides the point, but it can be prescribed by a doctor for other reasons.
Yeah, and it can be prescribed. A lot of young women and women in birthing ages can have ovarian cysts, so we do give it for that as well. So it can be therapeutic, not just for birth, not just to prevent pregnancy.
Okay. Any potential concerns with it, like health concerns?
Well, there are some people, and Dr. Nav and I will go through this together, who should not be on the birth control pill. One of them, first of all, you shouldn't be on it if you're pregnant. Obvious, but to some not.
Sometimes it's important to state the obvious, right?
And you shouldn't be on it if you have undiagnosed vaginal bleeding. So we have to figure out, why are you bleeding? So those things are important.
So even if you're like less than 6 weeks after having delivered a baby, you shouldn't really start the pill until after that initial 6-week period. If you're a smoker and over the age of 35, we recommend not being on the birth control pill, because then you increase your thrombosis risk, which is a risk of developing blood clots, especially blood clots in the legs and the lungs. If you have uncontrolled high blood pressure, that's another reason not to take it. So make sure your pressure is under control first. Or if you have a history of blood clots anywhere in your body, either currently or in the past.
You can't be on it. Yeah.
What else?
If you have any past history of ischemic heart disease, so like any heart coronary artery disease, thickening of the arteries, you shouldn't be on it. Or stroke, you shouldn't be on it if you have liver disease. Definitely not on it if you've had breast cancer. And certain migraines that have the neurological symptoms, where you have really severe auras or you feel like you can't see on one side, those people should not be on the birth control pill as well.
Okay. I have a question for you. What if you are pregnant, but you don't know you're pregnant and you're on the birth control pill? Can the hormones in the birth control pill damage the embryo?
That has happened in my practice, but no, you're fine.
Okay, so stop it as soon as you're not
And
pregnant.
honestly, if there is something that's not going to sit well with the embryo, the first 6 weeks and up to the 12 weeks, nature has its own way of just, you will miscarry if something is that drastically wrong. But generally speaking, no, it's fine.
Yep. Birth control pill, you shouldn't be on it if you have had breast cancer. Why is that?
So there have been studies that indicate that women who are currently taking the birth control pill, who have recently stopped it, may be at higher risk of developing breast cancer down the line. But the absolute risk is very small. So we talked in the past about absolute risk and relative risk. Relative risk is like, well, if 1 in 100,000 people gets it and then something causes 2 in 100,000, then that's doubled the risk. But really, it's still a very small number of people in the absolute terms. So there's one study that estimated that the absolute risk of developing breast cancer over a 15-year period, if you were between the ages of 16 to 20 when you started the pill, your risk would be 8 women per 100,000 women. 8 more women might get breast cancer than if they hadn't taken it. Whereas if you're between the ages of 35 to 39, then there might be an additional 265 women per 100,000. So yeah, it went from 8 to 265 per 100,000, depending on your age. But the important thing there is that it's still a small absolute risk. There are many other reasons women will get breast cancer that has nothing to do with being on the birth control pill. And that includes environment, genetics, diet. And then the other important thing there is that once you stop the birth control pill over time, then that risk also goes back down to the same risk as the baseline population.
Basically, it's reversible.
So how do you weigh it against each other? You say the birth control pill helps reduce chances of ovarian cancer, but if you have had breast cancer and you don't want, you're trying to prevent having it again, does being on the birth control pill increase those chances of having it again? Like, where's the benefit?
If you've had breast cancer, you wouldn't be considered for the birth control pill, so you're automatically out. So it doesn't really factor into it. It doesn't count. So if you've had breast cancer, you can't take it. you're not going to take it to reduce your chances of ovarian or endometrial cancer, but that is just seems to be a benefit. But no, it's not an indication to take it by any stretch of the imagination. No. So it really is an individualized decision. You have to look at the risks versus the benefits. But as Dr. Nav was pointing out the stats, and I was doing my math, super quick, your risk would be like 0.008%. Like it's nothing, right? So, but we have to be honest and tell everyone it is what it is. So let's talk about a little bit. So these are the two main ones we find. A lot of the patients will also use a patch. Commonly here, I'll give you a name, Evra patch, but there's other ones. With the patch, you're basically putting it on for a week, and you change it after a week, and you're basically going to have it 3 weeks on, 1 week off, and you would change it once.
Where do you put it?
You rotate it around like your thigh, your arm, like different places, and that is about 91% effective. Okay, so let's talk about the vaginal ring. I haven't had much experience in my practice, but I just want people to know it's 91% effective. You're basically putting a ring inside. I think you change it once a month, and it's releasing hormones again that will prevent you from getting pregnant. But it does require it to be changed once a month. Injectable, and here we know it as Depo-Provera, and it's basically every 12 weeks. It's an injection. With this, and the reason we don't use it as much is you do have to get it injected every 3 months. If you're on vacation or something, it doesn't align with your schedule, that can be a bit of a problem because it's not something you can do yourself. It is an intramuscular injection. And the other thing is you probably won't get your period for that entire time. And in our culture, that freaks people out. That what? And then I have had people come going, well, I didn't get my period. What if I'm pregnant? But you're not pregnant because it's birth control.
Right.
So it is very stressful for a lot of women to be on that, to be perfectly honest in a practical way, but it is a great option as well. The other thing I saw more when I used to practice in the States way back when is a contraceptive implant, which is a minor office surgical procedure. You implant a device in your arm, and then again, you just won't get your period, and then you have to have it removed. So
You won't get your period entirely ever?
while you're on it, you might get some spotting, but honestly, we don't see that very often.
Think how amazing vacations would be if you didn't have to worry about that, or like those big Indian weddings where you didn't have to worry about what you're wearing.
And then there's other things like the diaphragm, cervical cap, contraceptive sponges. Honestly, I don't see it. So I'm mentioning that there for people who perhaps are using it. It's a great option, but we just don't see it as much in my practice. Now, what I do see in my practice that does not have good success rates are the rhythm method, where you sort of time, I'm probably ovulating or not ovulating, and you have intercourse accordingly. The withdrawal method, not a great option. Ever. You cannot, you just need one little sperm to make its way.
That's right.
That can happen. And condoms, surprisingly, the fail rate's 20%.
That's huge.
Yeah.
So people, if they're using condoms, should be also backing that up with another kind of contraception if they don't want to get pregnant.
Yes,
Yeah.
I would highly recommend them. We're going to talk about sexually transmitted diseases in a separate podcast, but condoms are very effective for that.
Okay.
So they have a very important role.
Because today, when we're talking about effectiveness, we're talking about effectiveness in not getting pregnant.
Correct. So we're going to count that as a separate topic. And finally, a vasectomy, or having your fallopian tubes removed, to salpingectomy, as it's called. Those are basically 100% effective.
Right.
Okay. Nothing's 100%, but I would call them near 100%.
99.9%.
I'm going to be adventurous and say that, yes.
Okay. So this is all contraception if you are preparing yourself to not get pregnant.
Correct.
Can I mention one other thing? Sorry about vasectomies. Now we're talking about it. Men are so hesitant to get vasectomies.
Oh, I could probably, in the last 30 years of my practice, I could probably maybe count on one hand how many of my male patients or female patients' husbands have had a vasectomy. It is not a South Asian thing to do.
And it's unfortunate because they think it's going to be like, have an effect on their mardangi. They're not going to be like men anymore. It's going to kill their testosterone. And that's not true. All it does is it snips the tube between where the sperm is produced and where the sperm comes out. So if that's not anything to worry about for you anymore, then it has no other effect on any aspect of you having a pleasant time. So I would highly recommend vasectomy over a woman having her tubes tied, because you don't have to go in and get
Under
a
general
surgery at a
anesthetic,
general
yeah.
anesthetic. It's a quick, relatively painless procedure in a doctor's office. You've all heard the ads on TV for different doctors that perform it. It's super safe,
But
painless.
hello, if you've already given birth, either pushing that baby out or having a C-section, why do you have to go get your tubes
100%
removed?
agree.
Yeah.
Yeah. Men, take one for the team.
Yes. Okay. And last but not least, can we talk about emergency
Yes.
contraception?
Yeah.
I'm going to let you take that because you probably see that it emerge more than
I
I
did
do.
see it. I used to see it more often when it was prescription only. So you're
yes.
talking about Plan B or levonorgestrel. So this is a progesterone medication that is offered to a woman it's effective within 72 hours
Of
the time
unprotected intercourse,
sex. Yeah. So if you're thinking, oh my God, I might be pregnant, I don't know if my condom broke, or for whatever reason, and you don't want to be pregnant, then you just go to the pharmacy now. You can get this. I think it's from behind the counter, but
Yeah.
it's without a prescription. And you take this medication. It can make you nauseated, even throw up. So I usually recommend to patients that they take like a Gravol half an hour before they take it, so that it'll keep down. And then they'll have a withdrawal bleed sometime in the next week
Yeah.
or so afterwards. And then that's a good indication that it worked. So whether it doesn't mean you were pregnant and now you're not, it just means that the medication worked. And so then it might affect your next period, but at least you know that you don't have to worry about whether you're going to get your period or not eventually, whether you're pregnant.
And is it safe to assume that most people want to be prepared, and so they're taking using some sort of contraception in advance, and it's not going to be common for someone to keep taking the Plan B because as birth control?
It's a one-off.
Yeah.
Oh yeah, that's not birth control. That's like, oops, and you're scared and stressed, and that is an option.
Yeah. And one other thing I wanted to mention, I think, Mother's done a really, really good job talking about IUDs. And I think we forgot to mention that IUDs can also cause us to not have periods, which is also like a little bit frightening for women. Like if they
No,
stop
that's with
having-
the Mirena one.
just the Mirena
Just
one,
the
with
Mirena one. So
progesterone,
with the
yeah.
copper TIUD, you
Yeah.
can actually get a heavier period.
Yeah, that's right.
But-
It can be more painful.
Yeah. Well, yeah. It can be. But generally, yeah, you can have a bit of a heavier period. But the Mirena, any of the progesterone IUDs, you're right. You may not get a period, or you'll have spotting.
Yeah.
So to figure out which one's right for you, visit with your general health practitioner. Find out based on your health, your history, and your basically lifestyle, which one suits you the most.
We should talk about myths as well.
Oh, we should talk about myths. So one of the things we did talk about was that if you are on birth control, that means you're sexually active, and that is not true.
Well, first of all, it's no one's business. And second of all, it's not true because there's so many other indications, such as acne, such as painful periods, such as ovarian cysts, and the list goes on. Another myth I see is that if the woman is on birth control, well, then it'll affect her future fertility. That is absolutely not true at all. Like, not even an iota of truth to that. It does not affect your fertility at all. You stop the birth control pill, and you will have no issues getting pregnant if you are meant to be pregnant. It has nothing to do with birth control pill use.
Another myth that I've heard is that if you take the birth control back to back, like if you don't do the withdrawal week and you just keep taking it straight through, that's really dangerous or unhealthy for you. And that's not true either. So you can temporarily, I think for up to 6 months, you can do that.
Yeah,
Where you just take it so that you never get a period for that short period of time. And you can still go back to having regular periods and still be able to get pregnant after that time.
And I've also heard that it's difficult to get pregnant after you've been on oral contraceptives.
No, that's a myth.
It's another myth.
Yeah. And I'm going to leave you with this last myth that birth control or oral contraceptives can help in the prevention of sexually transmitted diseases. Wait.
Yeah, that's true. It's a myth.
That is a myth. Like, am I talking to myself? Yes, that is a myth. You need condoms to prevent sexually transmitted diseases, amongst other things that we'll talk about on our next podcast.
Thank you for joining us. Thanks for joining Dr. Nav, Dr. Madhu, myself on Avaaz podcast, here to talk to you about South Asian women's health issues. We hope you've learned a little bit. Please share with your friends and family. Please like, comment, and also let us know if you have suggestions for future topics. You can find Avaaz on Instagram, Facebook, Twitter, and YouTube. We look forward to seeing you next time. Thanks. The information in this podcast is not a substitute for professional medical advice, diagnosis, or treatment.